It's the start of an early shift for the men and women of the Mersey Regional Ambulance Service.
515 emergency message. It's an RTC query entrapment to the...
Rapid response paramedic Jason Sefton is on duty in the Anfield area of Liverpool.
I mean, any RTA, the first sort of injuries we're concerned about as an ambulance service is obviously if you damage your spine, then consequences can be quite dire, as in regards to patient being able to walk again. But here we are, we're landing on scene. Hello there.
It's this gentleman in this car on.
Right, let's have a little look at you.
Jim Helm was driving from nearby St Helens when he was hit head-on by another car.
There's your glasses, Pop. Have you any pains in your back, your neck?
Can't move.
Okay. Is that physically can't move or?
Just my legs, I can't move.
Your leg, you can't, can you feel them? You're saying you can't feel it? Okay. What you're describing to me is that you may have injured your back, okay? We don't take chances in things like this, we just can't afford to. If the fire brigade are on the way, we're going to get the roof off.
They must keep Jim absolutely still. If his spine is fractured, a wrong move could leave him paralysed.
Pop your arm here for me. And you've still no feeling in there whatsoever? You're starting to get chest pains, are you? Just throws the leads, you're complaining of chest pain as well now. Does it hurt you to breathe at all? It could be dangerous. Cheers. What we're doing as well, we're attaching cardiac leads to him. He's complaining of chest pain.
Jim has a history of cardiac problems. Jason's worried the crash may bring on a heart attack.
You getting a reading on that there, mate, on that monitor? Yeah, he's a little bit fast, 105. We'll have it out in 2 minutes now, mate, all right? Listen, it's not a problem, any time. You're going to hear a loud bang, all right? Don't worry about it. Good man. How's your chest pain now? Easing now, good. Pain. Right, here we go. The roof's actually off now as such, OK? Right. Can we get rid of this now?
On you.
Just 1, 2, 3, 30 degrees forward, yeah? I'm sorry, I'm sorry about the pain. We will get you out as quickly as possible. I apologise, Pop, I really do.
What are you doing on Jason, on you?
Everyone ready? Yeah. On 3, 1, 2, 3.
Nice and steady, take your time.
Just relax back for us, Pop.
OK, mate, OK, mate.
You okay, mate?
Well done, gents, thank you very much. Superstars. So far, so good. What we're doing actually is immobilising the gent's head and his spine on the spinal board. We're going to remove him onto the trolley, from the trolley into the ambulance, and then we'll give him a full one over, head to toe, where it's warm, safe. We can do the full hit with him then before we transport him off to hospital. Thanks. Thank you. Thank you all.
While the scene is cleared, Jim is rushed to the Royal Liverpool Hospital. The emergency department at the Royal is one of the largest of its kind in the country.
Could you put that back in the thing for us, the next to be seen?
Doctors Andy Breckle and Suzanne Evans are on standby to receive Jim.
Mid-thoracic pain, complaining loss of sensation in his left leg, pain in his right leg, loss of sensation in his left arm.
On 3, 1, 2, 3. Jim, we're just going to have to put your clothes off, okay?
Jim, is it lower back or sort of in this kind of area? In the middle part of your back. Can you squeeze my fingers tight? Can you give a squeeze? That's it. Can you do the same with this side? Can you squeeze my fingers tight? It's weaker on the left side than the right. Jim, can you feel me touching you here? Pins and needles that side. Any tingling here?
Not too bad.
Not too bad that side.
Jim, I know what's happening to you. It's a bit frightening, okay? So I just need you to be as brave as you are being up to now and just stay nice and calm for us, because we've seen all this before.
Oh, no, I know that.
All right, and we're going to look after you. Nothing horrible's going to happen, all right?
Jim, your left leg, just wiggle your toes on your left foot for me. Okay, just try.
Just keep your arm down.
Okay. And on your right, can you wiggle your toes on your right? That's fine. His neck is obviously a worry. The worst thing that we could find is that he's got a fracture, which is compressing part of his spinal cord. So, you know, the next 24 hours, he'll be continually reassessed.
A CT scan will show whether Jim has fractured his spinal column.
Are you warm enough? Would you like a blanket over you? Are you sure? Because it's quite chilly out there. Lovely, lovely, let's go. 182 emergency call for a 2-year-old child convulsing in her.
It's the first shout of the day for ambulance crew John Pollard and Willie Hanna.
Hot response. Control.
Well, we've just been given an emergency call. It's a red call.
There's a few scenarios we could be going to, but it's just a case of, in most cases, waiting and seeing.
Hello, honey bunch.
He's still sick from yesterday.
He was sick yesterday. He's warm, isn't he?
Yeah,
When Abdullah Ahmed started fitting, his mum Fatima called for help.
Hello. I know, mate, I know. Do you want me to carry him? Yo, has he had any help all at all?
No.
No, he hasn't?
No.
Right. Was his eyes rolling?
Yeah.
Yeah. Has he been ill recently? Has he had a chest infection, anything like that, or...?
I don't know.
No, you don't know. Sounds like he's had a convulsion. It's just a case of overheating. He's got too hot. Well, should we get you in the ambulance and we can give the lad some Calpol?
Okay.
And hopefully it might take his temperature down. When a husband turns up, if you can tell him to follow down the car, because then he can bring them home later on. All the hay.
Yeah, and you take you some clothes, please.
Okay, bring
Or
some
I
clothes
love-
for
yeah, or I love
baby.
thank you. Yeah, please.
Yeah, my love, you just take a seat there.
It's 10 mil. You can have the whole 10 mil, mate.
Right, my little one. Shall we just give you some of this nice medicine? There you go. This will make you better, won't it? I know it's cruel, mate.
شوف شيء يا حبيبي. لا
That tastes nice, doesn't it? A little bit more. After a while, it should help bring his temperature down, so he won't convulse anymore. There we go. I know it's a bit cruel sitting him like that, but we need to bring his temperature down. That's why he's got no clothes on, because we want his temperature to come down to prevent him from fitting again.
It's a 10-minute drive to Alderhay Children's Hospital. Today at the Royal, Sister Ali Mannion is running A&E.
There it is. So I shall do it now for you. Margie Oakes is down for Obs Ward, so you will be here anyway. So that'd be great. Fine, lovely. So if you want to go now, Anna will come in and give support in there. Great.
Andy's been called to resus.
So, Chris, tell us about this chest pain you've had.
21-year-old Chris Burton collapsed on the way to his friend's house.
Feels like Alan, you were taking drugs, coke and stuff, and you had a heart attack at 17, didn't you?
A mini one, yeah.
A mini one. And you were in hospital with that?
Yeah.
And did they actually say you had a heart damage because of it?
With all the drugs I was on.
Okay. Are you off the drugs now?
Yeah, after coke, yeah.
Yeah, you're off it. Not had any for, what, how long?
2 weeks.
2 weeks, okay. Okay, let's have a listen.
I'm only eating when I'm told to go.
And what, sorry?
I'm only eating when I'm told to go.
You made you. Good on you, Molly. Just sit forward for us, Chris. Okay, big breath.
That's it.
Again. Does it catch you at all? Okay. Any pains in your calves at all?
No.
No. You're not injecting any drugs at all? You're not injecting in your groin, anything like that? Okay. Well, we need to do these tests. We need to get some blood tests off. Put a little needle in the back of your hand, chest X-ray, the usual stuff, and make sure that your heart is fine. All right. So we'll start those tests now. Christopher has admitted that he's had some cocaine a couple of weeks ago, and cocaine can cause heart muscle damage. It causes arterial spasm, and there's a risk that he's developed some angina, which is like heart cramp, or he's had a new heart attack.
I'll just leave you for
Chris's mates have been waiting for news.
We've just been in to see him, and he's not looking so good. So, a little bit worried at the moment.
And you can understand that he's a friend, isn't he?
Yeah.
That's Christopher's ECG, which is his heart tracing, and possibly shows some damage previously, but there's nothing new. So my initial thoughts on this is that it's an angina, like a heart spasm, arterial spasm that's causing the pain. I mean, there's no point me just telling him the drugs are dangerous. He knows the drugs are dangerous. He knows it's damaged his heart once. It could damage it again, and he's still taking cocaine to some degree. So we're going to refer him onto the heart team, and we'll let them see if there's been any heart muscle damage.
Oh, yeah. Hey, do your favourite. Oh, fuck all this.
Right.
One of the patients in Majors needs Ali's special attention.
Well, you're going to have to stop shouting while you're in here. There's sick people in here, right? And there's ladies around. Little old ladies who don't want to hear your foul mouth.
Liz, I'll shut the fuck up, Liz.
Right, okay, thank you. Yeah. Yeah, he's been in before. He was in the other day. He's very aggressive, very violent.
Sorry, where is Jackie?
He's gone into HD2.
Dr. Rob Hunter has started his shift. Jackie was outside the hospital when she was hit by a car.
Jackie. I'm just going to stitch up the wound on the knee, first of all. It's not that big a laceration, it's a couple of centimetres, but it's gone quite deep. It's got a small laceration to the nose there, which will need a few stitches, but I want to see if there's any underlying fractures there before I start suturing on that. I'm going to put in some local now. It does sting. It's gone quite deep, this. It's down to the fascia, so I'm just going to put a couple of internal stitches in first.
Miraculous, really, isn't it? I guess it could have been so much worse. I had a meeting and I was waiting for the person to come, so I went over to move my car, and as I was crossing the road, the other car tried to cut through on the left, and of course he mustn't have seen me. And he just hit me, and I just remember hitting something face on, and then I don't really remember much for a minute or so. I just hit the ground. I've worked here for 22 years. Funnily enough, the one place I've never worked here is A&E.
That's everywhere else. So what I've done, I've brought the internal layers together, and it makes a much neater scar on the outside. So what we'll do, we'll get your facial views done, see what the damage is to your nose, depending on what they show. I'm sure that's broken, this looks broken. Just get the proper dressing on that.
Thanks very much, thank
and
you.
We'll get you x-rayed.
Thank you.
515 emergency call. Female collapsed on a building site, no further details of her.
There's that much building work in the city going on and that much renaming. It is difficult to keep up with everything. We'll have to just trust the sat-nav, because apparently it knows where we're going. Right. Down this way, is it?
22-year-old Chris was born with a hole in his heart. He's worked on sites with his dad William since he left school.
Nice fella. Chris, you hear me? I'm an ambulance man. Does he suffer with anything, Dad?
Yeah, he's got 2 mini strokes. He went into hospital. They were giving him, I think, an angiogram for an omnizone. One guy seen him, said he was clutching his chest.
Chest. Do us a favour, fella. Pop your hand in here for us. His SAT's a 99, his pulse is 70, which is good. We're just going to do his blood pressure. This is not his normal self at all, I take it? No. Is he normally quite chatty? Yeah. OK. Do you remember what's happened to you today? Do you know why I'm here? Do you know who I am? Do you know who you are? Right. His blood pressure's 135 over 91. That's good. These mini strokes, did he lose any speech or movement?
His speech went slurred, yeah.
Slurred.
Pins and needles in his hands
and then full recovery?
Yeah, he recovered.
Chris, what we want to do, mate, is get you off the floor, all right? We want to get you in an ambulance. It's freezing here for a start. You're laying on a concrete floor, which I'm not too happy about. Let me sit you up a bit. I don't want to sort of do it all in one, so we'll sit you up slowly now, see how you go. And then we'll stand you up and we'll get you over them ways, yeah? Push up tall. I want to stand stand. How's that feel? Can we just let go of you loosely? I mean, we were looking at his balance, his posture, his gait. Slightly wobbly than what you'd expect.
I'm going to try and make our way to the vehicle, okay? Yeah, okay.
BP's 14570, mate. SAT 98 and pulse 76. Apparently he was clutching his chest prior to going down. It possibly could be his chest, his heart, it possibly could be a mini stroke. I mean, he's only in his 20s. And to be going through that, it must be horrendous for both him and the family.
Chris is taken to the Heart Emergency Centre at the Royal Liverpool, while Jason already has another call. Miners is filling up.
Don't get up the skate shot.
So Andy's been called to help out.
Pretty busy.
Ali's son Lewis has been brought in by his childminder, as he's been hobbling for 2 days.
And I've just put it down to nothing. I think they've got to have the heads hanging off when you're a nurse, haven't they?
Oh, sorry. Show Andy where it's sore, darling. Point to it with your finger.
Round here?
Yeah.
This? Yeah, that as well. So we'll get an x-ray of his foot.
You fell off the fireman pole, didn't you? Did Daddy catch you? No.
On this side here, you've got this white shadowing. here, which just indicates there are 3 one-sided cortex fractures.
He's not tender there, though, is he?
No, it's tender on these. It's sort of third, fourth and fifth is tender, but obviously there seems to be a breach in the cortex.
What do we do?
Get him an appointment for fracture clinic. Okay. Yeah. She feels a bit put out the fact that she's missed this, but it's common in children to miss injuries like this because they're always injuring themselves. He would have just walked it off eventually, and it wouldn't have caused any long-term damage.
Bye.
Hello there.
92.
You okay, Elsie? What have you done?
Over.
You fell over. Okay.
I'm coming back from the fridge with the lettuce in my hand.
Elsie's been brought in by Raymond.
It's like elastic band there. It's tight.
Can you bend your knee for me?
I can bend my knee.
Can you lift your legs straight up in the air?
I used to do this years ago.
Pretty impressive. But you can still, obviously you can still do it. Yeah, it's quite swollen down there. Yeah, we need to x-ray your knee. Have a press over here. Yeah, we'll do the foot, ankle and knee.
He was in there, I had to shout to him to lift me up.
She's heavy, you know, you're heavy for one person.
So is this your other half then?
I'm his son! I'm his son!
515 emergency message. Toxteth Road.
We have an emergency call coming in, and it's in the Wavertree area of Liverpool, and it's an alcoholic fitting.
And it's safe to approach the scene. Control.
And we're on scene. I'm guessing it's these.
Hello? Hello?
Anthony Caldicott thought he'd beaten his alcohol addiction.
What strength's that? 9%?
But 2 months ago, he relapsed.
That's the first time I've ever took a fit in my weight. I mean, back straight, but never. I was wrong when I first.
Yeah.
The next minute I woke up and I was on the floor.
Was you? Is that when you've just phoned us now?
Yeah.
I mean, you're shaking there, your DTs, haven't you? Okay. What we'll do is SATs, his blood pressure, just a few little basic obs. I mean, obviously, the gent's asking for help, he's willing to accept help, and we'll get him the help that he we'll try our best.
I need to, can't get me on like this.
No, you won't be able to, mate, no. Not good, eh? Yeah. Have you eaten today?
Scared because I've never had this before. I'm really scared, mate.
Well, unfortunately, I mean,
I started, you know what, I was doing really well. I come off and done the programme for 3 weeks, and I just went for shopping. I was half one bottle of wine. That was 8 weeks ago. That one bottle of wine has just gone.
Just put you straight back.
Right,
back to square one. Yeah. His SATs are 99, they're good. Is it?
Well, all of it. Like my mate says to me, she said, you can't have one turn, you can't have one drink.
No, one stop alone. Yeah, I mean, that's the gent, he's diagnosed himself, and quite correctly, it's an alcoholic fit. And they are normal with alcoholism. You have to reduce your drink slowly. But I mean, what we'll do, we'll nip you down to the hospital, we'll get you checked out. We'll talk to the professionals on how to restart and get off it again. And yeah, well, absolutely. Okay. Anthony, I'm off. You take care. All right, mate. Ta-ra.
Anthony, should we get your things together and make our way?
This drink's a fucking killer.
When I see people like that, it's a bit sad, really, because they're addicted. It must be an awful thing to have to put up with. Awful. That's not just a Liverpool problem, that's a nationwide problem now. We deal with the same people, day in and day out.
In Miners, Andy has some news on Elsie's foot.
Elsie, I'm just having a look at your x-rays. Possibly a tiny crack in the bone, just a hairline crack just across there. I want to have a little look at this foot again, and I just want to press in a certain area, and I just want you to tell me if this is tender. Okay? If I just press around here, does that feel okay? Yeah. I think what's happened is you've gone over on your foot, and there's a tiny crack in that bone there, and I can see that on the x-ray. We'll need to keep your weight off that, and we'll need to put that in plaster. Right, so we'll try the crutches.
You know what? They call me the bionic woman.
I'm not surprised.
I've had that leg and that leg, and I'm cut right down here, and I've had my throat cut. I've had everything.
If you're a bionic woman, let's see how you manage a pair of crutches. That'll be the acid test. Let's see how bionic you are then.
In nearby Toxteth, John and Willie have just received the 10th call of their shift.
182 emergency call from North Ava.
It's the Vauxhall area of the city, which is just the other side of the city centre from us. It's a 3-vehicle RTA, and it's a quarry entrapment. Now, we know this piece of road well, and it is renowned for a couple of fatals in the past.
Cheng Min Zhao and his son Mark were on their way to their Chinese restaurant when their car was hit from behind.
Alright, have you hurt yourself at all? It's important to keep his head still, not to move his head. Is it a relative? Your father. Could you ask your dad, has he got any pains in his neck? He feels okay. Where my fingers are touching's not sore? It is sore. Right, ask him, it's important to keep his head still. Not to move his head. What's happened is this vehicle's been shunted front and rear, and he's got some neck pain. So what we're going to do is ked him out of the vehicle, which is put a collar on, and it's a back support to stop him hurting his back anymore, just in case there is any neurological damage. Might need a small. No, keep your head still. No, keep your head still. Hold his head there, mate. Okay, what we're going to do is put a board under your bum, twist you around and slide you up onto the bed, okay? Here we go. That's it, on the board now, there. Let go! Board up here, 1, 2, 3. Brilliant, cheers for that, fellas.
Just going to put a strap around your chin and one round your head, okay?
Although Mark's not in pain, doctors at the Royal Liverpool will check him over.
Because the gent was complaining of neck pain, I mean, it's quite easy to say, oh, it's only a slow-speed impact, it's only whiplash. Well, until we're certain through x-rays or it's been cleared by a doctor, then the ambulance service always treat for the worst. I mean, people have had minor shunts like this and ended up paralysed from it. People have been known to walk away, be shouted, turn to look at someone and dropped and been paralysed for the rest of their lives. So if this looks dramatic, then it's for the benefit of the patient.
As Cheng is taken to be checked over, Ali's been called to an incident in the hospital foyer.
Excuse me. Thanks, ladies. Hello there.
Patient James Dowd only left his ward for a cigarette, but collapsed before he could make it back to his bed.
Hello, darling. Okay, all right. Okay, what we'll do is, can you come and give us a hand, please, Gail? That's all right, darling. We'll sort you all out. Don't you worry. Okay, darling. I'm underneath.
Ready?
Okay.
1, 2,
I'm just going to stand.
3.
Yeah. Okay. There we go. There you are, my love. Okay, let's get him straight through and into resus. Okay, let's go. Yeah.
Right.
Thanks, Denise. Thanks. Going right through. Did anybody witness him falling or anything? Just get him in. James, can you hear us? Yeah. You all right there? So I've got my pass.
All right, James.
Do you know this gentleman, love?
Not at all.
Okay. Okay. This gentleman's collapsed in the foyer. There's a patient on the 9th floor. He's obviously bitten his tongue or his lip there. James, all right. Hang on, we just need to keep him up. Sorry. This shoulder either clearly dislocated or whether it's just done something before. It's James Dowd, and he's an inpatient on 9A.
9A.
All right, love. What are you on 9A with, darling?
Sorry?
What are you on the ward with?
I had a fistula fitted a month ago.
All right, so got trouble with your kidneys
I
then?
had to do it again yesterday.
James, I'm just going to get you undressed. Thanks, Lynn.
Tests, all right.
GCS 15, no witnesses, just a collapse to the floor, complaining of a painful shoulder. And that's all quite cynosed on arrival of us.
You went out on a cigarette, did you?
Yeah, all right. That's the culprit then.
Bad for you.
All right, thanks very much.
James will be monitored until he's strong enough to return to his ward.
Just got one of your patients who's just collapsed outside. We've brought him through to A&E resource. Can somebody come down with all his case notes, please, and come and identify the patient?
You thought you were going to pass out, and then you tripped and fell as you went to sit down. Did you feel dizzy? Did you feel like you were going to pass out? Or did you just trip? Has that happened to you before?
It's quite common that we get calls like that of patients who have actually collapsed in the foyer, and we go around and retrieve, and more often than not, they're patients from other wards. So just get them checked over here, and they'll probably go straight back up to the ward.
It's 7 o'clock, and the end of another busy day for Jason.
Well, it has been a hard day actually, and a very productive day because I know I've definitely made some difference into the outcome of what I've dealt with. I'm looking forward to actually getting up because I've got to take my wife out to the birthday. But I've still got to organise things yet.
As the day shift at the Royal go home, Ali hands over to Sister Carmen Aspinall.
Do you want to handle any transfers? Go out and look after your little babe. Go home and squeeze my surgeon.
What's that? Where'd you get him from?
Dexterity.
Oh, look, squeeze a surgeon. What's that? The stress relievers, aren't they?
Yeah. That's it for today. Back again at...
Let me one. I want to squeeze a surgeon.
Oh, it's only for my Lewis.
Andy can finally catch up with one of his patients who's staying overnight.
So we'll go now and see the bionic woman. That's the one.
Don't worry about the foot.
How are you doing? You okay?
Again.
Now then, I suggested that you stay with us tonight, rather than trying to manage the crutches at home.
I've got to be out by Saturday night.
What's happening Saturday night?
I'm going out.
You're going out? We don't want to stop you going
I'll have
out.
a little dance with him, you see.
One little dance.
We hope so.
We'll be out before Saturday night. We'll get you out tomorrow.
Yeah.
You okay?
Yeah.
Okay, so we'll see you tomorrow. Bye-bye.
For John and Willie, it's been an even later finish than usual.
Probably missed that first pint then, now, eh?
Yeah. You've heard of the rugged look. Well, this is the buggered look.
That's called slept in there.
Yeah. Lived in. It's got that lived in look.
It's like a base couch on a skip.
Thanks, mate. You say the nicest thing, huh? Of course, you look like George Clooney, don't you?
Thanks, mate.
Yeah.
Not more of a Schwarzenegger type character.
Yeah.
Strong yet gentle. In touch with me feminine side. Will be when I get into bed anyway.
Yeah.
Cornflakes, Stella in bed.
Yeah.
I might just cut out the milk and just put the Stella on.
Yeah,
the
just
cornflakes.
cut out the middleman.
Incredibly, Jack's CT scan showed he had no fractures to his spine, and he left hospital 4 days later. Chris's tests were inconclusive, but he's back at work and waiting for the operation to correct the hole in his heart. Anthony spent 4 days at the Royal and is now receiving professional help in his fight against alcohol addiction.
A footballer has died in his bed. Not pleasant, but the death detective's on the case next on BBC 3.